Welcome to the Guardians of Hope podcast, where we bring together parents, nonprofits, legal, and medical experts dedicated to positively impacting children's lives. I'm your host, Cynthia Ramsaran. The thoughts and opinions of my guests are not necessarily my own, so thank you all for joining and sharing. Welcome, everyone. Today, we are diving into a crisis that has been building for decades, but intensified dramatically during the pandemic: the isolation of mothers and the dissolution of traditional support networks. The saying goes, it takes a village to raise a child. But in today's world, that village seems increasingly hard to find. We're seeing mothers shouldering overwhelming responsibilities without the community support that previous generations relied on. From families moving away from their parents and extended relatives to the intensified pressures of the pandemic, we're witnessing what some experts call a silent crisis of maternal burnout and isolation. Joining me to discuss this is a family scholar and associate professor of human development and family sciences at the University of Connecticut, Dr. Shannon Weaver. Dr. Weaver, thank you so much for joining me. How are you today?
I'm doing good, busy. And thank you for the opportunity to talk about an issue that is incredibly important and oftentimes uh, completely overlooked in our society.
Absolutely. Why don't you start by talking to us about your background in family sciences?
Well, actually, all three of my degrees are in human development and family sciences.
Mhm.
And my area of focus or interest is gender, and particularly how gender influences and shapes women's roles and responsibilities within step families. And for the past few years, one of the main sort of large projects I'm working on is a longitudinal study looking at the well-being, physical, emotional, social, relational of parents impact from the pandemic. So we started collecting in April, May of 2020, and we've collected, I think, 4 waves now because we were really sort of interested to see how parents were faring during a very stressful time. So that's a large part. And I also do work on the importance of women and perpetuation of family rituals. So,
Excellent. Thank you for sharing that with us. And we have a lot to talk about. I want
yes, we do.
to I want to start by talking about what we mean when we say the village in the context of raising children and how that concept has changed over recent generations.
Well, that's kind of an interesting question because when I went kind of looking to see sort of how people had defined it, and it comes from sort of like an old African sort of proverb, and I think in some ways we've got some ideas about you know looking at it from a couple of different levels. Both from like an interpersonal family relational level, and then sort of looking at it sort of broader from an institutional level and sort of that structural supports that are in place or not to assist families and in particular parents. So, the thing that I always find interesting is as a nation, the United States is very pro-birth, but we're not very pro-child. And when you kind of look at the institutional supports that would assist sort of families, in particular mothers, they've been lacking for the most part over the course of history. Although there's been a couple of times we've seen some things. But we can also sort of look at sort of, women nowadays are spending more time in sort of childcare and household, domestic tasks than either mothers were, back sort of 20, 30, 40 years ago. So women are spending more time not only sort of engaging in these tasks, but they're also spending sort of greater hours at paid labor. So basically what we're seeing is women have fewer hours to engage and spend time with friends. And actually, I think a recent Pew study found that a majority of working mothers stated that they didn't have time to spend with friends because after meeting sort of all the demands that we have. So nowadays people work longer hours. They are spending more time in care tasks, not only with children but also with older family members. And what does that mean? It means that we have very little time for leisure activities or other types of sort of infrastructural supports. We can also talk about the fact that people sort of living at greater distances and sort of like the lack of sort of connection or sorry, I'm trying to think of what I've had this. One thing that we've seen is actually, people living further distances apart, which can sort of vary by one thing we've seen in terms of socioeconomic status, as well as regionally. And I think that, even when people live closer, such as in the Northeast, a lot of the times, even sort of getting to sort of family members can be difficult given the way, like our current transportation infrastructures are set up, things along those lines. So.
Thank you. So we talked about distance and somewhat socioeconomic factors. You talked about research showing that people are living further away from their families, but are there any other types of factors that drive the geographic isolation?
Well, I think one of the things that we got to look at is, like, for example, people tend to live closer to family members in the Northeast and the South than they do in the West, and like mountain states, for example. And a large part of that is because, in these regions, it's more of a rural setting, and people in rural settings live at greater distances. And it's a lot sort of more difficult to kind of. So we've got this kind of like geographic, almost regional sort of difference in terms of, the amount of family members that you're near to. But we also look at, for example, sort of people who have higher incomes tend to live further away from family members than those with lower incomes. So a large, I think, part of some of the stress that we're seeing are from women, who are earning a decent amount, but still sort of lacking sort of affordable access to childcare or other types of supports, such as, time for friends or time to de-stress themselves. And even if you have people or family members nearby in the area, doesn't necessarily mean that they would be sort of sources of support. Because we've kind of, when I think of It Takes a Village, I love the idea and the sentiment, because I think it reflects both the interpersonal resources that are needed to be a good parent and to be a good mother, but also the structural supports that are necessary as well. But when I think about sort of a village, and a large part of the research that we've been using in our work has kind of focused on the idea of, people have talked about sort of perceived support systems or personal safety nets of basic support for mothers, such as those that look at not just sort of financial, but also emotional support, social support, childcare assistance, things along those lines. Because, I mean, when we look at working parents, like less than 30% have any form of backup childcare. So, when the demands hit, we're sort of at a loss. And we saw that definitely happen during the time of COVID, because more than 2 million women ended up leaving the workforce at that time due to sort of childcare restraints or being unable to find adequate childcare. Now, here's what's interesting, though. More women, mothers of children over the age of, or under the age of 18 and under, are in the workforce now than they were before the pandemic, which I think is kind of interesting. So right now, like, I think about like over 3/4 of mothers with children under 18 are in the paid labor force, which is sort of up from 64% in 2021. So in some ways, we've seen women kind of gain sort of back some of what they've lost. But, a large part of that is coming from them making sort of concessions in some ways, maybe be able to work from home, but women find that much more difficult to do than men working from home, because a lot of the time you're working, trying to do work and take care of your kids, and like the division between the two has kind of come together, but then we can also talk about the idea of, that means sort of not being able to leave work behind because it's always there, kind of looking out over our shoulder and including sort of like the tasks that you need to do around the house. But our society was basically not really set up, the hours of the work week, was created basically. I know Barbara Riesman talks about this. She's from, I think it's the Council on Contemporary Families, which does a lot of sort of research looking at sort of experiences of families today to sort of guide policymakers. And one of the things that they've and she's talked about is the idea that the work week was basically set up with this idea that you had a single earner who had sort of a housewife, which we know, for a certain period of time, it was possible for some families to survive on one income. But, nowadays, basically, we have, for the most, both fathers and mothers sort of working. And even in two-parent families, that doesn't leave you enough time to do all the tasks that need to be done that we have assumptions for. And it's even more difficult if you're a single parent.
Mm-hmm. Well, you're talking about the pandemic. I know that a lot of women left the workforce during the pandemic because of that. Some are coming back. It's been 5 years. What barriers are they facing once they try to come back?
Well, I think part of the challenge, I mean, there's some that are immediate and others that are long term.
Mm-hmm.
There's like the motherhood penalty when, like, I mean, for example, women, and if we look at sort of like differences in wages between men and women, in terms of women earning, less than men do, even when you control for hours worked and, areas of occupation and things along those lines. But, one of the biggest sort of differences in pay is like women kind of who are sort of in their 30s to 40s, biggest discrepancy. And people have talked about because of kind of like this motherhood penalty, and even if you're working, similar hours, but, having to take time off to do certain things or perception, that you're not sort of as committed to your job, even though like you are. But if you don't have adequate childcare or that follows through, like, what are you going to do? And, we saw with the pandemic, like how the lack of infrastructure, for childcare really created a huge problem. So for right now, women coming back to work, even though we've seen increases, because we saw a significant number of childcare centers and childcare providers that closed or stopped working. At the same time, even though we've seen sort of centers reopening or other people coming back to provide care for families, but it's not to the level that it was before.
Mm-hmm.
And, we are like basically, one of the few industrialized nations that does not have subsidized childcare. However, here's what's kind of interesting. There was one period in time when the US actually did make the argument that childcare was sort of a required infrastructure, and they actually funded it. Can you guess when that was?
2020.
No, 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 no. Actually, the one thing that's kind of interesting, I talk about this in class, is, that, right now we don't sort of have it, but actually during World War II. So
Oh, when women had to help in the war.
yes. So in
Yeah.
1943, Congress allocated $20 million to create the nation's first and only sort of childcare program under like the infrastructure law of, like, I think it was the Lanham Act, along those lines. So sort of like they sort of talked about and provided for like sort of communities, cities, and companies to set up hundreds, they called them war nurseries. So basically, during the course of the war, they enrolled some, estimates are somewhere around like 500,000 or a little bit more children. And unfortunately, this didn't meet all the demand that was there. But here's what's sort of interesting. It was like the first and only time really that the US government acknowledged childcare as critical infrastructure because they needed women to be working. And the center was affordable, actually, for those people who pay for childcare. The average cost of parents was 50 to 75 cents per child per day, which kind of like in like, current numbers would be $9 to $14 a day, which,
Wow.
yeah. And you look at now, like, for example, Massachusetts, the average cost of childcare where I live is like $16,789. I think you're in New York, and that's like 12,844.
Are you
So
talking per year?
yes, per year.
Yeah. Okay.
So, actually in 29 states in the District of Columbia, 1 year of infant care is more expensive than a year of tuition and fees for college. So, I mean, childcare is expensive. And one of the things that we see is the increasing numbers of women working. Now, some mothers have always worked. Like when we talk about sort of women from sort of working class, or, women of color, always kind of being in the workforce. There was that period of time, in the 40s and the 50s where, we did see sort of women, and particularly who are white, who stayed home with their children because, we had economic policies in place that enabled us to live on a single sort of income. And corporations paid larger sort of aspects of taxes and things along those lines. But one thing I do want to emphasize is that, systemic supports, institutional structures put in place to support families can be there. But, for example, subsidized childcare would be huge. Some people have talked about, basically, if we had subsidized childcare like most, industrialized nations do, GDP would sort of increase by $1.6 trillion.
Wow.
And that's been the argument that a lot of people have talked about in trying to get women back into the workforce. But I think also when women leave the workforce, not just during the pandemic, and we can talk about their health and their well-being, one thing that we found in April, May of 2020, women's stress level increased significantly and stayed high, for years. Whereas like men, their stress really didn't increase until wave 2, which was the next November, December 2020. But women kind of began high and kind of continued sort of to be high during this time. And that sort of had important implications, for their depression and their anxiety, things along those lines. And one thing that we do know from long periods of stress, creates inflammation, and not only sort of impacts you kind of socially in your stress level, but also like physically, and health-wise, greater risk of cardiovascular disease, heart attacks, even cancer.
Yeah.
So,
Dr. Weaver, you talked about families and partners and how moms or women stress levels rose, and men probably stayed the same. Why don't we talk about how partners and family members can help mothers or support mothers who are struggling with these feelings of isolation and stress and physical?
but the thing about like interesting, I think about support, okay,
Yeah.
and we can talk about like the need for childcare. I could go on and probably gone on too long for that, but perceived support from friends and family is incredibly sort of important. But the positive impact of social support, in particular from friends and family, is more the perception of it rather than the actual amount. So a
Right.
long sort of standing finding we have is, for example, for new mothers, sort of the perception that they have an available support network to them, we've seen linked with lower rates of postpartum depression. Other studies that have looked at sort of like it's the perceived amount of support rather than the actual received amount of support that's had positive impacts on lower rates of depression and anxiety, and sort of relation to like higher mental sort of health and personal sort of happiness, things along those lines. So the thing interesting is it's sort of like, the perception of support being more related to particular positive outcomes for mothers than actual. So I think it's not only sort of having the support available and showing it, but that mothers themselves are sort of aware. But here's the thing, I think that's a challenge for those of us who study and we work with families. We really, don't know much, you know, um, because the reality is that we know moms, anecdotally and also in research, report the desire and the need for care, that being a mother is very isolating. And, we've got the numbers to show that they're overwhelmed with, we've got very high expectations for mothers, but sort of low levels of support in a lot of different ways. But, we really don't know what types of support mothers want, like what support is that they perceive to be available to them, like how they're using it, who is providing it. Now, from a little bit of the research in terms of what we know, I mean, friends, huge source of support, particularly for mothers, and the need to sort of have regular time to interact with those, that, sometimes, your mother friends are important, but also friends that are friends for you as a person, if
Yeah,
that makes any sense.
it does.
Um,
Yep.
And I think unfortunately one of the things that we've seen is like women talk about really a lack of having that time because you're just kind of exhausted. And the limited time that we have, it's emphasized in our society, okay, you should spend it with your kids, and women are spending more time with their kids. But or also for those that are partnered with their spouses. But for couples, particularly where if we're talking about heterosexual six gender couples, for couples where the partner perceives that housework, childcare, and care responsibilities are their responsibility as well, and that are supportive with their partners, we do see positive impacts, having a partner there that's helping. Unfortunately, women spend, on average twice as much time with their children than their male husbands, their partners do. They're more likely to also be engaged in sort of more of the, like, let's say, less palatable tasks of motherhood, speak, pleasant. And we can sort of when we look at these sorts of situations, you know, we've also got this leisure gap of like downtime to sort of have. So when are you going to be able to do these things? Um, it's There isn't much time there.
Yeah.
So um,
So, one last question for you, Dr. Weaver. Just for our listeners who are recognizing themselves in this discussion, mothers feeling overwhelmed without adequate support, or, making time for those friendships that are really important, and other types of self care, what resources or first steps or any advice you would recommend based on what you've been learning in these past in your years of studying?
well, I think, the one thing we have to understand is like, I have a friend, a therapist who works with families, and she always talks about you can't pour from an empty cup. And
Mhm.
unfortunately, we kind of get this idea, in society, particularly for sort of for mothers, is as selfless and sort of, putting your children first. And I think you can't be a good parent, and in particular, you can't be a good mother if you're not also caring for yourself. And it drives me nuts. I think we need to also change our language when it comes to self-care, because self-care is necessary. But people sit there and say, I'm going to get enough sleep this weekend, or I'm going to sit down and eat rather than, like, eat on the run. And I'm like, that's not self-care. Those are things that are needed for living. If you don't get enough sleep, you die. And one of the things that we saw during the pandemic in particular, lack of sleep, was very sort of detrimental to sort of well-being and people's stressors. We did see, however, like getting outside was useful for mothers, but they really didn't have much time to get outside, so to speak, to help them. So I think, the first thing, to be a good parent, you have to be, good to yourself, and getting adequate sleep, and, eating healthy. But those things take time, but also I think sort of setting clear boundaries, and not feeling guilty or bad if you're not able to do things. But just even sort of getting outside and walking for 20 minutes a day does
Mm.
huge sort of benefits for people's sort of health and well-being. And stopping and taking a moment, because even sort of doing something creative for like 5 minutes at the beginning of the day, and creative can be whatever that you sort of want it to be. One of the greatest resources that I really like quite a bit is a book on burnout, because it was talked about completing the stress cycle. It's one of those
Yes.
things, actually, I use it in my classes to discussion, because they talk about, like, in mothers' busy lives, we can't get rid of all of our stressors, those things that cause stress in our life. And unfortunately, when you have repeated sort of stress, this causes sort of long-term inflammation. But you need to complete the stress cycle, even if you can't get rid of the stressor. So there are things that you can do that kind of send a message to your body to kind of sort of shut down that fight, flight, freeze, or feign
Mm.
sort of experience. And one of them is sort of doing some sort of quick walk outside, doing something creative, even having a pleasant conversation with a stranger. Like, so when you're picking your kid up from childcare and someone's walking out, smile and say hi. I mean, there are things along those lines. The Nagoski sisters, Nagosky, and their book on burnout, I think, is a great resource for parents. But I think, mothers need to sort of understand that there are lots of high expectations, but a lot of those we place on ourselves. And, we haven't even gotten into like the whole mental load issue and things along those lines.
Yeah.
Um,
Yeah, it starts with us, is what you're saying. It
well,
starts,
well,
yeah.
Yeah, yes and no. But I think like in a lot of ways we have to advocate for ourselves on a personal level, but we
Mhm.
also need to advocate for ourselves sort of on structural and institutional levels. We're the only country that doesn't have paid parental leave, nationwide. Family Medical Leave Act, which you can take unpaid leave, but the majority of people really can't afford not to sort of take unpaid leave. And even so, that is only covered in certain companies. So, a significant number of people are employed by small companies, which aren't covered by these policies. So, we sort of need to understand that, we need a care infrastructure. But also we need to start looking at sort of like the work week and things along those lines. And people kind of need to step up. I think the problem is that women, we've been told for years that we can have it all, but they really, and we should, but they really didn't say that meant that we would be doing everything.
Mhm.
So, we need sort of greater support and assistance, not only from partners, but also sort of for friends and others. Now, how to get that to happen can be a bit of a challenge. So.
Yeah. Well, Dr. Weaver, thank you so much for your time.